for lumbar decompression, you want the belt here, right about at this crease. The thoracic belt just hangs like you want it hooked into this cushion here. Head cushion we just move for the patient.
Out of curiosity, which one's a cervical belt?
So for cervical, we actually use this one.
Oh,
here.
God, you mentioned.
Yeah, so completely different setup. So, Dr. Rick, I'm gonna use you as my test dummy. All right, so I'm just gonna lie on down. So you're gonna sit here, then lie down, head going towards Shani.
So here and down.
Yep. So ideally, we want the patient's butt like in this general region here. So we can also scoot the belt around, so that's not a huge problem. We take this belt here, this comes up. Yep, you come on up here. We loop, we cinch tight. We want to go across the hips. Make sure it's nice and tight. Going across the hip bones, they will be able to breathe. And if they can't, then that's a big bowl of their problems. This center loop here, we want this to be right in the center when it's done. So you want it to be a little bit off center when you start. When you tug it, it's gonna move over. Get that nice and tight. All right, you can breathe?
Yes.
Perfect. And this one here comes up and it loops right into that center loop. And what I recommend for everyone to do before you begin, you pull and you lean to get this slack out of it. Because the machine's gonna do that anyway. All right, arms up and thoracic belt. KDT recommends you go around here, but for the Chattanooga you have to go around the ribs. Okay, and now you're all secured. So all you do from here, in this machine, you have to hit the rope release button, pull it out, and rope release button again. Then it just comes to your settings. So set your minimum and maximum levels. Usually, you want to start off at most a third of the patient's weight, and you gradually go up from there. 50-30 is always a good start.
50-30.
Yeah, that's always good. It's always pretty good. There's wolfish for lumbar. For cervical, it's a lot lower. And then just raise the table up. Gotta find my buttons. All right, so. And once you hold the slack out, you can unlock the table. Oh, where's the elevate this one? This one's new. Should be a little button to raise this bad boy up somewhere.
When you say raise it up, you mean like raise
elevate it? Yeah, but elevate the table.
Wasn't it on the computer though?
It might be.
To raise it.
Let me see. Traction table. Now it's my soul times my steps. That's usually somewhere in here. There's definitely gonna be a button somewhere. Let me explore on this table. It's been a while since I used this one.
Gotcha. Yeah, I've got 2 car accidents. What would you build this as? Manual therapy or?
Not traction. Oh, there it is.
Oh, this is still considered traction 97012?
Yeah.
What?
That's nice to know.
Now,
This defeats the whole purpose of me wanting to do that now. Because you can't use stim on it. Well, yeah, but you can't do the roller and this. And
no, you can only do one or the other.
darn it. Alright, well.
It's one or the other. Kevin's looking at adding different versions of, like adding new billing code for it.
Yeah.
But he's also going to be jacking the price up, so good luck pushing that.
Okay.
Yeah, then you hit the start button.
I guess I should have asked you that question first. There's no point in me doing this, using this machine now.
What? There's always some people who work for.
Well, yeah, but I mean, 97012, I'd rather just use the rolling table, add that with stim. I don't know.
Yes, well, if you people with a particular pain, then that'll probably be like the.
Also, we have the F&D table for it, but no, I hear you. I'm just playing devil's advocate.
I know. It's if only it could be both. But
Yeah, I was hoping it was like a manual therapy code or something.
So start plugging, it'll start doing its thing. You should see the belt. So you guys see it'll hook into the hip bones, Sean. If the belt slides way past down the hips, it's not secure.
Yeah.
It should kind of just hook in. You should be able to see a little movement. Now, I unlock the table for lumbar traction so the patients feel a pull. It doesn't benefit the patient to unlock it, it just makes them feel they're getting something out of it. Our goal isn't to stretch their back, even though they like the feeling. Our goal is to decompress the spine.
Okay. So the patient per se might not feel it, but it's for the spine's purpose. Gotcha.
Yes. Is to basically the discs are pushing are smushed together when you press it. Yeah. Offload the nerve. Open up the airspace so blood can get there easier.
Gotcha.
Heelys, good things. All.
And how long is this one? 12 minutes?
Yeah.
Okay.
I usually do between 8. We usually do between 8